In Zimbabwe, we used to say, shura matongo. It's very bad to have HIV. I discovered that I was HIV positive. I went on denial. I said their machines are not working. I even went to the New Start Center and I was told that you are HIV positive, and I teared off their results slip. They're lying. I don't have HIV. I thought that if you are found HIV positive, it's death sentence.
En 2016, Médecins sans frontières a publié un rapport sur la situation de l'accès aux services antirétroviraux en Afrique de l'Ouest et du Centre. Et ce rapport présentait une situation alarmante, le fait qu'un grand nombre de personnes vivant avec le VIH n'avaient pas accès aux services requis pour le traitement. Alors, nous avons mis en place, avec l'appui financier du Fonds mondial, le modèle d'observatoire communautaire sur le traitement, c'est-à-dire un modèle avec les personnes vivant avec le VIH au centre de l'action et mise en œuvre par les communautés. Donc, dans ce modèle, nous collectons des données le long de la cascade VIH, donc depuis le dépistage, l'accès au traitement, pour s'assurer que les populations puissent avoir accès à ces différents services.
Mon rôle ici, en tant qu'agent collecteur, c'est de collecter tout ce qui est difficulté sur les sites, de faire remonter ces difficultés pour qu'on puisse faire le plaidoyer et puis ensemble régler tous ces problèmes pour l'accès facile à nos patients.
L'Observatoire permet de renforcer les capacités de ces communautés-là pour qu'elles-mêmes puissent prendre et puissent assurer le lead de leur prise en charge et puissent être parmi les décideurs qui animent le plaidoyer pour améliorer leurs conditions.
I was keeping it to myself until I knew about ZNMP+. That's where I started to interact with other people, sharing their experiences. And then I discovered that, HIV is not that bad. I can live with the virus.
The CTO helps us to know whether there is a stock out or the stock level is going down, and that we bring to the attention of the relevant authorities, and now they take action. And if action is taken, drugs are available at the health facility, then definitely people will have access to their medication and they continue.
The community treatment observatory is like a watchdog. So without a watchdog, where is the accountability? Because we need the data to be able to get the evidence for advocacy.
Before the ZCTO, what used to happen was that whenever we had challenges at the community level, we were not able to generate enough evidence. But with the ZCTO, we can realize that we now have both quantitative and qualitative data that can convince stakeholders that definitely we need to do something around this issue so that people have treatment to the levels that they require.
They've been keeping us on our toes. Toes in the sense that they've been putting pressure on us in terms of whenever there are stock outs. It's like, they give us the alert, and we are forced to work with other partners because we assemble other partners to help us to quickly distribute drugs.
Il a été constaté qu'un groupe de personnes, notamment ce qu'on appelle les populations clés, n'avaient pas nécessairement accès aux services.
HIV, when you start treatment and you get interruptions of your treatment, it will lead to what is our worst fear, which is drug resistance. So we really want to see how we can contribute.
I'm a person living with HIV and also with a disability. And working for people who live with HIV has been a passion because I know how it feels to be treated with stigma and discrimination from the community. And I know how it feels to be different. If we work with people living with HIV and also with challenges or disabilities, I think it will be good because we actually bring people together to know their HIV statuses, if they are on treatment, which helps us to identify which lines or regimens are actually working for people.
Déjà, les populations vivant avec le VIH, pour la plupart qui sont défavorisées, à qui on imposait des frais sur les sites de prise en charge qui étaient des obstacles. Donc l'Observatoire a évidemment travaillé pour que ces frais-là s'arrêtent et que désormais un client ne soit pas empêché de venir sur un site parce qu'il doit payer. Donc ça, quand même, on l'a relevé et l'Observatoire a poussé le ministère de la Santé à prendre un arrêté de décision pour dire que sur les sites désormais, on ne doit plus faire payer les clients. Et ça a été un aspect majeur de l'intervention.
La demande d'observatoire est très forte. Dans tous les pays où nous sommes passés, la société civile demandait comment vous pouvez nous aider à mettre aussi en place ou à continuer les actions d'observatoire que nous avons démarrées.
I'm a community health agent doing data capturing at the facility. I think this program should go everywhere. The clients are very happy because if they have challenges, they come to us. You can say it's okay, it's been solved. We can take your cases further.
This is about the community. It's about community ownership. It makes the community feel part of decision making.
Renforcer les capacités de ces communautés-là, à prendre leur destin en main, pour dire qu'on ne doit plus tendre la main, mais il faut que nous montrons que nous aussi, on représente une force qui peut aider à transformer la société.
As a next step, we really want to see how we can scale up. Because if we scale up, then more people will have access to quality treatment.
C'est un modèle qui peut être mis en œuvre partout dans le monde. La preuve, ITPC le met en œuvre en Afrique australe avec le Zimbabwe, le Malawi et la Zambie.
Let's use the gains made in West Africa so that our colleagues in other parts of the world would benefit from it.
Community treatment observatories allow every government to hear from its citizens. No national strategic framework for HIV should exist or be operating without data from the community. In fact, no monitoring and evaluation system should exist without routine monitoring data from the community. And no donor should invest without it.
Communities are determining the parameters and monitoring the trends. Communities are leading the advocacy and partnering with stakeholders to implement solutions. Only people living with HIV feel the effect of service delivery. So who better to lead the transformation of service delivery?
The Community Treatment Observatory is not just a model for community monitoring and HIV service delivery. It can also be used to track public spending, police brutality, and electoral corruption.
Now is the time to scale up Community Treatment Observatory. The project is working in West Africa and in Southern Africa, and we are already adapting here in India. Now is the time to scale up this project because there's so much work to do.
CTUs are truly the future.